Hi everyone, my name's Carly Mantone, and today I will be discussing fetishistic disorder. The diagnostic criteria says that this needs to be over a period of at least 6 months, recurrent and intense sexual arousal from either the use of non-living objects or highly specific focus on non-genital body parts, as manifested by fantasies, urges, or behaviors. The fantasies, sexual urges, or behaviors cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The fetish objects are not limited to articles of clothing used in cross-dressing, as we see in transvestic disorder, or devices specifically designed for the purpose of tactile genital stimulation. For an example, a vibrator. So a diagnosis of fetishistic disorder requires concurrent fulfillment of both the behaviors in criterion A and the clinically significant distress or impairment in functioning noted in criterion B. So continued, we need to specify what the body part or non-living object that is being fetishized or other, like an article of clothing or something like that. We also need to specify if it is in a controlled environment or in full remission. For in a controlled environment specifier, it's primarily applicable to individuals living in institutional or other settings where opportunities to engage in fetishistic behaviors are restricted. And then when we specify when it's in full remission, there has to be no distress or impairment in social, occupational, or other areas of functioning for at least 5 years while in an uncontrolled environment. So some associated features with this disorder, it can be multi-sensory experience. For example, holding, tasting, rubbing, inserting, or smelling the fetish object while masturbating, or preferring that a sexual partner wear or utilize a fetish object while having sexual encounters. Majority of those with fetishistic sexual interests also enjoy sexual experiences with their partners without using their fetish object, but those that do have the fetishistic sexual interests often want their sexual experiences to be involved with their fetish object, and they also feel they'll be more sexually satisfied than the use without it. Minority of those with fetishistic sexual interests see their fetish objects as obligatory to becoming sexually aroused and or satisfied, and some may have very extensive collections of their highly desired fetish objects. Some functional consequences include sexual dysfunctions during romantic reciprocal relationships when the preferred fetish object or body part is unavailable during foreplay. Some individuals may prefer solidarity sexual activity associated with their fetishistic preferences, even while involved in a meaningful, reciprocal, and affectionate relationship. So the course for paraphilias and specifics have an onset during puberty, and fetishistic sexual interest can develop before adolescence. This also tends to have a continuous course and will fluctuate in intensity and frequency of urges or behavior throughout their life. Some culture-related diagnostic issues we see is that it's reported more in men, but can also occur in women. The gender difference is smaller for fetishistic fantasy than for actual fetishistic behavior. In clinical samples, this disorder is nearly exclusively reported in men. Certain cultures are also more sex positive than others, which can influence paraphilias and different sexual practices. Culture and socialization influence human sexual desire, and certain cultures might place major importance on certain body parts and certain sexual practices over another. Okay. So the etiology for this disorder, it's been included in the DSM under various iterations since its inception in 1952. Paraphilic disorders, especially fetishistic disorder, have been viewed as a way to control deviant behavior, and some may say that it actually doesn't meet the criteria for a true mental health diagnosis. A diagnosis for fetishistic disorder is highly controversial due to the lack of valid data and scientific consensus. So the word fetishism actually originates from the Portuguese word fetico, which means obsessive fascination. Etiology continued. So some theories include childhood experiences, like maybe if a child was going through beginning stages of experimenting with like masturbation and things like that, they might have had some type of object or just some type of object that they catered to a little bit more during that experience. There's also biological factors like an abnormal brain development. Cultural factors. Study have shown a difference in rates of fetishism in cultures that approach sexuality differently. Neurological causes. There was one neurological idea that may explain foot fetishes, which is that the region in the brain that processes sensory information from the feet is actually adjacent to the area that processes sensory information from the genitals. So this neurological idea came from a neurologist named Vilyanor Ramachandran. I hope I said that correctly. And he suggested that there is a possibility of a neural crosstalk between the two areas of the brain. And then another thing I wanted to note was that body parts whose cortical representation is further away from the genitals are less likely to be fetishized, which can give an explanation as to why feet are maybe the most common fetish that individuals choose. So for comorbidity, this disorder may co-occur with other paraphilic disorders as well as hypersexuality. Rarely is a fetishistic disorder associated with neurological conditions as well. So differential diagnosis include fetishism, which the crucial difference in this new terminology is that fetishistic disorder required there to be significant distress, impairment, or harm accompanying the pattern of sexual behavior in order to be designed as a mental disorder. Transvestic disorder, this comes from the intense sexual arousal from cross-dressing, manifested by fantasies, urges, or behaviors. If someone's fetish is limited to articles of clothing, consider transvestic disorder first. We have sexual masochism disorder, which this should be considered first if the fetish primarily involves forced cross-dressing. So one thing I did want to mention was fetishistic disorder versus fetishistic behavior. So those who identify as fetish practitioners or fetishists that do not experience distress, impairment, or harm to self or others are not classified as having a mental disorder. So we just have to remember that having distress and impairment to or harm to self or others is what classifies a fetishistic disorder. Sorry. So for assessments for this disorder, we actually see that a lot of the assessments used for sex offenders is also used or could be used for those with fetishistic disorders. So we have the phallometric testing, we have the vaginal vaginal photoplethysmography, visual reaction time, polygraphs, and other physiologic methods of assessing sexual interests. For treatment, we have that sex therapy is helpful with a specialization in paraphilias. CBT therapy is also helpful to identify and change the fetishistic behaviors with a combination of medication. SSRIs can help with mood disorders, which can often lead to a side effect of a diminished interest in sex. So a lowered sex drive can help with impulsivity associated with fetishistic thoughts and behaviors. Medroxyprogesterone acetate and cyproterone are both members in the class of drugs that lower testosterone levels temporarily in order to reduce sex drive and allow for more effective therapy. Over my readings, I think I've realized that the most effective form of treatment would be any type of sex therapy, CBT therapy, group therapy with the combination of medication. So the case presentation that I have here says Robert, who is an 18-year-old male, was always a very shy person and didn't have many friends other than boys his whole entire life. When he was around the age of 12, he found a pair of his sister's underwear and began to feel aroused by the feel of them. When he started experimenting with masturbation, he realized he couldn't get slightly aroused unless he was thinking of the underwear's texture. So he would get up and go grab a pair of the underwear to hold on to while he masturbated. Over the past 6 years, Robert has continued to hold and feel the underwear in order to reach ejaculation. His need to hold and feel the underwear while masturbating has caused him immense distress within his life, and he has continued to have trouble forming romantic relationships with women. Robert also feels guilt daily, which also is affecting his focus in school. So based on this, his present diagnostic symptoms show that it's been over a duration of at least 6 months. Persistent and extreme sexual arousal as manifested by fantasies, impulses, or actions through either the use of non-living objects, in social, occupational, and other significant functioning areas. Fantasies, sexual impulses, or actions cause clinically significant distress or disability. So I ruled out the diagnosis of transvestic disorder because, as we see, his fetishistic desire does not include getting aroused by wearing the underwear. It's mainly just from the feel of it, which gives which should have a better diagnosis for fetishistic disorder. And that is my presentation, and then right here is some resources that I used for this. Thank you so much.